it hurts kind of at the front of your shoulder where your collarbone ends and you're having a hard time lifting your arm above your shoulder, I'm worried you may have rotator cuff tendonitis or rotator cuff syndrome. The muscles of the rotator cuff, as you can see on this model of a scapula or shoulder blade, with the supraspinatus, infraspinatus, teres minor, and subscapularis, that all help the shoulder rotate externally, rotate internally, and abduct or raise the shoulder. You can see also that there's a very narrow gap where this tendon can get pinched between the collarbone and the bone of the spine or the acromion of the scapula. Many people will notice that when they try to raise their shoulder, they get a pinching sensation here. So what we want to do is talk about how to get back your range of motion and strengthen up your rotor cuff to prevent further injury or to rehab from an injury you're already dealing with. I usually like to start with some internal and external rotations using a rubber band, or you could use an old bike tire. We want to be able to use just the rotation through the upper arm without letting the elbow move too much. I like to take a little bit of a towel or a small pillow, and you can use it to pinch your elbow to your hip. Then you can load up your affected shoulder with that rubber band until you've got a comfortable amount of tension, and it's pulling my shoulder into external rotation. Then I'm going to do 10 or 15 repetitions of internal rotation, keeping that towel pinched into my hip and bringing my fist or my hand to my belly. The next thing that I'm going to try are some external rotations. I'm going to take that towel, I'm going to pinch it into my hip with my elbow, grab onto my bike tire or rubber band, and then I'm going to let it pull me into a comfortable amount of internal rotation, and then do some external rotation. With all exercises, notice that I want to be careful about making sure that I'm stacking my shoulders appropriately, ears over shoulders, over hips. I'm not letting my shoulder round forward. It's down and back. Loading up that shoulder into internal rotation and pull that arm out as much as possible. You might even think about pointing your thumb in the direction that you're moving your arm. Can we get 10 or 15 repetitions right here? It's also very common to lose range of motion in our shoulder, and so we want to very gently be able to regain that range of motion. So one thing I recommend that my patients do is sitting next to a counter or a table like so, with the level of the table at just below shoulder level, we can rest our arm here and we can do some finger walks back and forth as far back as possible. Can we bring our elbow behind the line of our shoulder and forward as much as possible until we're about straight? As we get more range of motion over a few weeks, then we can change the level of the table. For example, like so, and continue to do our walks so that it's a little bit more elevated relative to the level of the shoulder. After we've done our range of motion finger walks, we want to start working our external rotation strength. So with our elbow resting on the table, can we gently lift our hand off of the table? Sometimes you can only hover for an inch or two, and that's fine. Can we raise it up as far as we can, hold it for a breath, and gently set it down, going for 10 to 15 repetitions. As we do this, after a few weeks, we might notice that we're getting more and more range of motion. So we want to continue to comfortably push how high we can lift that arm. Remember, we're not going for sharp pain, but it's okay if you feel something interesting that doesn't cause you to grimace. As we continue to get stronger and gain range of motion, it will be beneficial to put a little bit of resistance into these exercises, and you can do something like holding on to a can of beans or a can of soup to do your rotations. Really focusing on not letting your elbow move and rotating through your humerus here. We also want to work on stability through our range of motion. You can find these shorter, less strong rubber bands at your local sporting goods store or even Fred Meyer. And what we're going to do are some goalposts or elbow extensions under tension. Holding the rubber band in my wrists like so, what I'm trying to do is, like always, shoulders down and back, squeezing my shoulder blades, and trying to pull my hands apart, not flaring at the elbows, but rotating and pulling my wrists apart. Can I raise this guy up and down? We want to find your particular range of motion. Relatively gentle. We're not going for sharp pain. I don't want you to compromise either at your spine or one arm versus the other. Just nice and easy. Control here is the goal, not necessarily for distance, speed, or tension. You should notice a gentle burn on the outside of your shoulders. It's exactly what we're going for. You can do that straight up, or you can do it in front of yourself like so. Also very important is to make sure that we maintain and improve our internal rotation of the shoulder. Internal rotation involves being able to put your hand behind your back, ideally be able to go between your shoulder blades, but if we're having a lot of shoulder problems, we're going to start wherever your body is at. A rubber band like this, or an old bike tire attached to a door handle or a pole. We want to start with good posture, ears over, shoulders over hips, shoulder is down, shoulder is back. I've got my hand looped through the rubber band, and I'm going to step away until the rubber band tensions my shoulder to a comfortable degree, pulling it back behind me. And then with my thumb facing out or my palm facing forward, I can do 10 or 15 micro repetitions, gently bringing my hand forward while keeping my shoulder organized. We do 10 or 15 repetitions with our thumb out, and then we can turn our thumb back and do the same thing, keeping a strong and straight elbow, gently bringing that arm forward, under control, with a consistent velocity until our shoulder comes back to the end of the range of motion. After we get comfortable here, and it might not be today, but over the next few training sessions, you might try to bring your hand behind your lower back while it's under tension. And you go for 10 or 15 general repetitions this way. As you continue to progress and get more comfortable in this position, you can even do some micro repetitions trying to bring the back of your hand into your lower back. This may be uncomfortable, and a little bit of discomfort is fine as long as it's at what I would consider an interesting level of discomfort. If it's forcing you to wince or tense up, then we want to back away a little bit until it's a tension or intensity level that feels comfortable for you. Again, I want to make very certain that I'm not letting my shoulder come up and come forward, because that compromises the rotor cuff by pinching the head of the humerus into the acromion and clavicle. So again, shoulders down and back, gentle tension pulling my hand back away from my lower back, and micro repetitions. Many times we damage our rotator cuff because of the way we push and pull. For example, if my shoulder is elevated and forward when I'm doing pulling maneuvers, that impacts the humerus into the clavicle and the acromion of the shoulder blade. Whereas instead, if I rotate my thumb out and pull my shoulder down and back as if I'm trying to pinch my shoulder blades together, then when I do a pull, I want to bring my elbow to my hip and point my thumb away from myself. Notice this keeps my shoulder down and back and then I've got the point of connection attached to my center of mass, as opposed to if I were pulling in this direction with a high elbow and an up and forward shoulder, then the tension is not very well connected to my center of mass. My shoulder is in a compromised position, more likely to cause injury with repetitive use or under heavy loads. So once again, thumb out, shoulder down and back, pinch my shoulder blades together, and bring my elbow and wrist down to my hip. I might even use my torso a little bit and point my other hand in the direction that the rubber band is coming from. By putting some torsion or twist through the torso, you're also engaging your core and teaching your body how to organize the entire system around a point of attachment or a point of power. So again, when you're doing your 10 or 15 repetitions, shoulders down and back, elbow and wrist to hip, twist at the waist, and point your other hand at the direction of the rubber band. So once we've finished sweeping the floor, we may want to work on the range of motion through our latissimus dorsi, or our armpits. When we have rotator cuff problems, we very often have limited range of motion overhead, which I find can be due to tight armpits or the pull-up muscle or your latissimus dorsi. One of my favorite ways of helping improve this problem is by sitting in front of a counter or kneeling in front of your couch, and you can hold a pole or a broom like so, and with our hands maybe a little bit wider than our shoulders, we'll keep our forearms parallel, and we can set our elbows here on the table, and we want to sink our hips back until we feel kind of a gentle stretch in the bottom of our armpits. And while we're doing this, we can do a couple different things. One, I'm actively trying to pull my hands together. I'm not actually letting them slide on the broom, but I'm really trying to do this motion without actually letting it happen. That helps to activate some of the internal rotation muscles, which can help improve your range of motion there. The other thing that I'm doing is I take a deep breath, and as I let it out, I'm trying to sink my head in between my arms or my biceps and letting my chest fall to the floor. Once I feel a good stretch, then I can pull myself back up by driving my elbows into the surface, and that brings my hips forward. Another deep breath, let it all the way out, and sink your chest to the ground and let your head fall in between your arms, pushing your hips back. Feeling a gentle stretch in your armpits, and then driving those elbows straight down and using that energy with the tension in your armpits to pull yourself back up. So once again, 10 or 15 repetitions of this exercise will dramatically improve the range of motion when you're trying to lift your arms overhead. As you get better, or you notice that you're improving your range of motion, you can walk your elbows in and keeping your hands further apart for a little bit more of a stretch. The other thing that you can also try to do is when you sink down to the bottom, can you pull the broom to your head like you're doing a curl? Can you pull it behind your head? Or if not, just pull it gently to your forehead. That will help also improve the range of motion on the backs of your arms or your triceps.